Hello, this is Dr. Nicole Williams. I will be doing a lecture, YouTube lecture, however you want to say it, on developing a service plan at the case management unit. So, we all know what case management is. It is basically what it sounds like. It is the practitioner managing the client's case. Okay. Case management happens a lot in agencies such as, I'll give you, I've talked about Department of Social Services. That's a good example because in the Department of Social Services, whether or not you are family preservation, kinship care, adoption, you are managing that case, right? So you're trying to make sure that the client's needs get met, and because the client's needs are so vast, that requires that the case manager, which if you work for the Department of Social Services, the social worker has to manage all of the different needs of the entire family. Okay. All right. And if you see me looking over here, it's because I have two screens, and this screen is so much bigger than the screen in front of me. I wish I could find a way I wish my, what do you call it, camera was on this screen. But so what we're going to do in general is just look at what it involves, describe how to involve a client and the client's family in preparing a service plan, demonstrate how to use the client's assessment to develop a service plan. We're going to talk about some of the areas in which you are going to assess. There it talks about strengths, um, define the meaning of individualized planning in the context of human services, list six barriers that can impede development, and we probably won't do that one, and demonstrate how to create a service plan. So that's the one that we will focus on as well. So the introduction, once again, so when we're talking about case management here, basically it says that, so you're going to use the information received from other agencies and the information that you took to develop basically the social history at the time of your interview with the client. And once you do that, the next step is to develop a plan. So depending on the agency basically that you work with, the population, the plans have different names. So they can be called a service plan, treatment plan, goals, whatever the case may be. When you get to the agency, you will see the paperwork that your agency requires to do this case plan. Then the social history is that typically tends to be pretty basic from agency to the agency. Even when I was a therapist, we use that social history as the initial intake. So that social history is basically getting the initial information from the client, and that tends to be very basic or standard regardless of the agency that you work for. But basically, in doing that, we're going on to the planning part now. You're going to take all of that information, and then you're going to have to begin to create a plan for the client. So it says service plans can start off to be very broad, general goals based on the client's needs and the general case management agencies. So in thinking about the case management agencies themselves, so remember, when you're doing case management, the agencies themselves do not typically provide or do not provide all of these services. So, once again, what makes it case management is that you have one client or you have clients, and they may need everything from substance abuse treatment to housing support, support with BG&E, support with their children in school, legal support. So once again, it's this case, and there are all of these needs that your clients have, and your goal is to set goals for each of those, and then to make sure that that you have resources put into place so that the client can get the service that they need. So basically, it says clients independently seek help from specialized agencies such as children's grief clinics. The creation, so that necessitates the creation of a comprehensive plan tailored to their specific needs. So once again, you have agencies that provide services. Boom. Right? So if a child is going to this agency, that agency is going to focus on that child's need from the grief perspective. Okay. However, once again, what we're doing is we are the case manager. So we're looking at a more holistic perspective. So when we're dealing with these cases, it's not only the child's grief, but it's any other issues that the child might be dealing with. And we're going to coordinate basically care for that client. So developing a general service plan. So you as a case manager, you do not need to give the actual service or treatment. So we know that. You develop the general goals the provider agency is to address. It can be mental illness, substance abuse, alcohol abuse. Some goals will be service goals. So it might be welfare assistance, in-home care, transportation, educational or occupational goals. But once again, these goals are general for the provider to address in detail with the client. And a good service treatment plan should be identify goals and and empower clients by using their strengths to meet these goals. Okay. Unfortunately, like this little circle right here is blocking some of my PowerPoint, some of the words. As with anything, you always want to involve the client and the entire family. So case management is, we know that one of the most important things in human services is collaboration, collaboration, collaboration. So when the client comes in, you're collaborating with them. You've already assessed their needs. So now we're going to begin to collaborate in order to connect them to the appropriate resources. Now, it doesn't mean that sometimes before the client gets in, we may, you know, start to look at the goals that we want for the client and we begin to kind of have a thought process in reference to the resources. But once that client comes in, we can present the information to them and then the client may say, no, I really would prefer to go to this resource for my addiction. I have been there before, et cetera, et cetera. So it should be basically collaborative. So using the assessment, once again, the psychosocial assessment that you have done, by this point you should be doing in Professor Meisler's class. I know that is your final, one of your final things that you're doing is doing the psychosocial assessment on yourself. And this basically is a broad assessment that looks at the client from a holistic perspective. And we're basically using that assessment and using the information in that assessment to start to create the service plan. Okay. All right, so of course, the first thing when you're talking about developing either a treatment plan, your service plan is the goals. And what I need you to do is pull out your packet and go to the page where it says Wildwood Case Management Unit. So that's the fake name that the authors chose to use for their case management company or agency. Okay, so if you go to that page. All right. So first, I'm just gonna before we go through the particulars, as you kind of see on the page, you're gonna fill a page out, right? So if you go to that, what is the client's name? Who is the next of kin? So that information should have been received during the intake process. I want you to check initial plan. All right. So this is the initial plan and the date. You don't need to do a review date. Review date is when you're actually updating the plan. Okay. Develop with is the person. So you develop with who did you develop the plan with? It's like what family member? Was it the mother, the father, the grandmother? And you want to put that person's name. Level of case management. I will go through that information with you in 1 minute. Case manager is yourself. And the provisional diagnosis here is once again, if you had to act. So provisional is not the formal. It's kind of like, okay, this is like our initial diagnosis. Okay. And then you're going to see the different situations here on this page that clients can have issues with: income, housing, vocational, which is job, educational, transportation needs. Sorry. Are there medical needs? Activities of daily living. That is the client's ability to do things that they need to do for themselves. Can they get up in the morning? Can they actually wash up? Right? We have clients like if you have a client that is severely depressed, something as simple as getting up to take a bath may seem it's impossible for someone that is dealing with depression. So that is an activity of daily life. Can they take care of themselves? Are they eating on a regular basis? Can they run the errands that they have to run? Are there any legal concerns, recreational and leisure time? Okay. Mental health, substance abuse, family relationships, support, social supports, and other. Okay. So these are the categories that you're going to evaluate your client in. And of course, your client is not going to have all of these. Okay. All right. Some of these will be strengths. Okay. And then some of them will be needs. All right. And then full transparency, some of them may not be a strength or a need. Okay. But I think to kind of keep it clear, yes, it may not be a strength or a need. So, like legal, right? Well, I guess if they don't have any legal issues, that's a strength. So, however you want to put that. All right. Okay, so here on the screen, basically what you're seeing is examples of goals. So once again, these goals are going to be very specific to obtain housing, to make positive changes regarding family members, to obtain mental health services, to obtain physical health, to recognize precipitants to hospitalization and take appropriate actions, to obtain social support, to obtain employment, to obtain a new life, to make positive changes, to obtain legal counsel. So, as you see, these goals, it's nothing, it's very, very, very general. Okay. And for my client students that had me for theories of counseling, you might see that this looks a little bit different from your therapeutic goals. All right, because these goals are really, really basic. Although for theories of counseling, the goals can be basic too, like to decrease depression. Okay, but these are just that, right? They're not layered. They're just what it is. This is what we want our clients to obtain. Okay. So the first thing that you're going to do is kind of go through that list and decide what are the needs of the client, and then do a general goal for that. Okay. The next thing that they're going to have you to do is you're going to see identify client strengths. So this is just right here on the PowerPoint. There is just information to help you to think about what are the client strengths. Do they have community supports? Like, are they involved in church? Are they involved in clubs? Is the school system a support for them? Are they involved in religious and cultural beliefs, practices? They values that are supportive and comforting. Do you have a client that has really great interpersonal skills, special abilities? Um, what what the person should choose to do as a preference, uses particularly with children. So that can be a strength, whatever they prefer. Activities that they do. So if you have clients that have hobbies, that is a strength. Remember, we always want to go from a strength-based perspective. So we always want to make sure that we're not just looking at the needs, but we're looking at the strengths. And the strengths they don't necessarily have to do anything with the actual issue. The strength is the strength. If a client says, I love to go roller skating, then you want to put that down because that is a strength. And that's something that we can use actually in treatment, because if they enjoy doing that, then that can be something that they do as a part of the healing process when they're stressed out, having that activity, having that something productive to do. Okay. Are there people, groups, or pets that give the client support and comfort? Okay, so you actually have this sample goal plan. Once again, this is the same sheet that we're currently on, and now it's on the screen. So basically, once again, you see how the information has been filled out. Okay, and then you see here that they begin to assess the client. So income, financial, that's his strength. Why is it a strength? Because they receive disability insurance policy. from an insurance policy. Housing, that's a strength, why they own their own home. Okay, vocational, that's a need, they need a job. Okay, transportation, well, that should be a goal because there's a need to be able to independently, to be able to drive independently. Okay, comments can be addressed in therapy. How they're going to do it, referral is Lending Counseling Center. Okay, so that's how they chose to deal with the issue about being able to drive independently. Okay, because evidently there may be some issues where the client doesn't feel safe driving by themselves. So that's dealt with in therapy. All right, here's something else medical. That's a need. Here's the goal to diagnose and stop having headaches. Okay. And referral is going to go to Michael Philip. I can't see that last name, but Filippo, who is a neurologist. Okay. And then sometimes you see here that's nothing. So beside legal, that's not a strength or a need. Activities of daily living, not a strength or a need. Okay. Now here vocational, it said would like to return to a job and has no job to return to. I'm not sure why the authors don't have a goal there, but it should be a goal there. Does that make sense? All right. Go to the next one. Okay, mental health. The goal is to reduce or eliminate symptoms of PTSD, and that's going to be the Lindy Counseling Center. Family relationships, that's a need to reestablish with the 9-year-old son. Once again, the Lindy Counseling Center. All right, social support, that was a strength. So they just, in the comment section is where you can see they tell you why it's a strength. Okay, and the case manager's name. So let me just be clear. I know this is not to confuse you, but right now you are the case manager. Okay, I know that when you did the ABC assessment, I said think about you're the actual treating therapist. Right now you're the case manager. Okay. So when you are talking about, for an example, here to reduce or eliminate symptoms of PTSD, what counseling center, what therapist are they going to? Not you this time. Okay. We're going to put another hat on. You are now the case manager. So we got to put the case manager hat on. Okay. All right. Once again, they do not have to have a strength or need. I will give you a number because I do want to see that you have the ability to do these goals and to write a basic goal and then to also have a resource for that goal. So I will let you know in class what the number is that you should have. Okay. I don't want to look and see that you've only checked 2 things. There should be several things that are strengths. There should be several things that are needs as well. Okay. So for levels of management, case management, sorry, excuse me for clearing my throat. So there are 4 levels of case management, administrative case management. These are our clients that tend to be a little bit more independent or very independent. So when this happens, basically clients are placed in a pool of clients, and there's somebody that's going to basically follow up beyond the referral, right? So I'm sorry, I keep on clearing my throat. So once again, you this is not the intent. You're following. This is just like you're following up on the client. So there might be a worker practitioner. She's given a case file, I mean, a list of clients, and she's just kind of saying, well, let me follow up with so and so to make sure that they scheduled their psychiatric appointment or that they were able to get into this inpatient unit, whatever the case may be. Okay. Resource coordination, this is what you're going to be doing for this case. So this is where clients are in needs of services and such as housing, medication, therapy, employment, things like that. So this case plan would be resource coordination. Intensive case management, that is basically when clients are at high risk for rehospitalization. So they need definitely intensive case services to make sure that they are getting the help that they need so they won't be hospitalized again. And then targeted case management, these clients have the same case manager through stable times and also crisis. So kind of continuity of care. A good example of that is when I worked for Department of Social Services under family preservation. this is pretty much what we did because we had a client, and for 4 to 6 weeks it was more intense in reference to, so basically for the first, when we had the case, we worked the case for a certain period of weeks where it was intense. You're meeting with the client on a weekly basis. You have to spend a certain number of hours with that client. That would be resource coordination. And then once we actually closed the case, then we had to do a follow up at 30 days and then like every 3 months. So if something happened during those three, as you're following up, of course you would support the client, but that would then become targeted case management, where once again we're just basically following up with that client. It's your caseload, so it's not the same as the administrative case management where there's a pool of people and you have one person just kind of following up. So I still had my cases, and the cases that I had to do, I had to follow up on those cases as the same as my colleagues. So when you start to do that, hey, let me check in on 30 days. Okay, let me do a check in at three. We did a check in at 3 months, and then a check in at 6 months. And that is that continuity of care. And what we did find with case management like that is when we would check in, sometimes there were needs that need to be attended to. Okay.
All right. Y'all probably like her outfit is different. Wait a minute, y'all. Let me fix. Don't look. I look real crooked, don't I? Okay. Yes. Day 2 of taping. All right. So what I need you to do at this time is to take out this packet. All right, that I gave you, and this is the packet that you are going to actually turn in to me. So once again, it is handwritten. So make sure that you're writing neatly, okay? Unfortunately, we do not have electronic versions of this. So, okay, so I need you to get this out so that you can kind of walk through. We're going to walk you through each of these sheets. So the first sheet, the Wildwood Case Management, so that's just the name that the authors picked. That doesn't mean anything. They just picked a fake name for an agency or a case management unit. But the face sheet is something that if you look into a client's profile or client's record, on their record, there typically is some face sheet that gives basic information. Okay. All right. So when you look at the face sheet, you have the first box. Everything is pretty intuitive: name, address, agency number. Don't worry about that. Or you can just give a fake phone number. Okay. Home and phone number, home work number. That's for the client. Guardian, you don't need to worry about that unless you are doing, of course, a case management plan for a younger child. Because this is on the ABC client, you don't have to worry about that. Address, okay. Well, no, address is already up there. So that address would be once again for the guardian if you were providing services for a child, right? So don't worry about home or work. Okay, next of kin, if different from guardian. Okay, so once again, you don't worry about that because your client is an adult. So you just need the name, agency number. You don't have to worry about that. Their address, make up an address, their home number, their phone number, and that's it. Okay. Date of first contact would typically be the date that you do your intake, taken by yourself, date of birth, their gender, their marital status, educational status, high school diploma, college graduate, okay, employment status, employed, unemployed, veteran status. If they're not a veteran, you put not applicable, currently pregnant, NA. If they're not pregnant, required prenatal care, of course, that's going to be NA, giving birth, pregnancy. You don't have to worry about those if they're not pregnant, okay? And then actually, I think I want you to stop right there. Current medications, if they are on any medications, you can put that there. But because this is like a fake client, just stop basically, I just need the date of first contact, taken by, date of birth, gender, marital status, educational level, employment, and veteran status. You don't have to worry about the rest of this, okay? Only because I don't want you to do so much thinking for a fake client, okay? But just in general, if this was a real client, you would answer these questions. So if they were taking medications, you would put the medications that they're taking and who is the doctor that they're being treated by. I'm sorry, current medical conditions, current medications prescribed by, legal status, incarceration. You would put any issues there. You know, if they have issues, you would put that there. Previously incarcerated for 10 years. Substance abuse problems, if they do have any of those, you would put cocaine dependent, heroin dependent, whatever that might look like. Reason for a visit, the reason why they are getting case management, referred to, so if they had any other services that they were getting, you could put that there. Psychotropic medications, those of course are your medications for like anxiety, depression. May not call these numbers, and this is just, you know, once again, they might say, don't call my home or don't call my work number, and you will put that there. This is a really, really bad, once again, copy because I had to literally put the textbook on the copier machine. There's something that says DX right there. Under reason for visit, you see something that says DX. That is their diagnosis. Was there a psychiatric evaluation done? If that was done, you can put yes. You would put yes. Psychological evaluation, so that's different. So psychiatric evaluation is by your psychiatrist. Psychological evaluation is by your psychologist. And if they were court ordered, when were they court ordered? But once again, this is, I don't want you to do any of that, okay? Because once again, I don't want you thinking, trying to get, you know, you already have to kind of fabricate a lot of this information. So I don't want you to have to overthink. But I just wanted to explain to you what those things are. So once again, you're just doing that the first box, and then date of first contact, taken by, date of birth, gender, marital status, education, employment, and veteran status, and that's it. Okay. And then of course, assigned case manager would be yourself. Okay, we're going to move on to the intake assessment form. So this form should look very familiar, as all of you have done, or some of you that are taking this class at this, or got permission to take this class at the same time as Sarah's class. This is your psychosocial assessment, your social history. Okay, not going to go through this. Okay, you know what this is, so don't worry about that. I mean, you know, and the date of the assessment is the date that you're actually writing this. Unit number, once again, don't worry about that. These are just things that like the agency might say, oh, unit number 5 to indicate case management unit, whatever. So don't worry about unit number, but you're going to basically fill this out to its completion. Okay, you're going to keep on going. Sorry for you can hear the paper probably through the microphone. So you're going to keep on going, keep on going. And once again, this information is based off of your ABC assessment, but of course, this client is your client, so they're giving you a lot more information than the crisis that occurred. Okay. Now, if you go on to page 383, the mental status exam. Let me stop right here because I think that's the next PowerPoint slide. So remember, we've gone through this mental status exam. So this is what you saw during the intake, and we went thoroughly through this. You did an activity, so you're just going to check what you saw in reference to that client's mental status, their appearance, their behavior, etc. Okay, so that's pretty intuitive. And then on here, you will see, once you finish that, you will see interviewer summary of findings. So you're going to talk about the mental status exam, what you saw. So basically, you're just going to give a summary, all right? And this is where some of that clinical writing comes from. So this is where this type of thing or this type of practice is important in reference to not only being able to do the mental status, but then also being able to just do a brief summary of those things that you checked. Okay, substance abuse. So here, if they do anything, tobaccos, that's smoking cigarettes, alcohol, illicit drugs, prescription, OTC, over-the-counter drugs, you want to put that there. All right, and are they experiencing any type of withdrawal, blackouts, hallucinations, patterns of use, things like that. All right, so once again, even in your assessment, some of you did indicate that your clients were starting to use more frequently because of the crisis. Okay, but once again, remember, even for some of you that didn't say that your client was using anything. Once again, this is your client. You dealt with the crisis. Now they're coming to get case management. So you're doing an intake on them. So maybe things have changed, and maybe this client, when you met them during the crisis, they weren't using. Now they have started to use maybe more over-the-counter prescription drugs, or maybe more alcohol. So once again, I don't, I want you to feel free to be creative and give your client more issues than they had during the ABC assessment. But if your client doesn't have any drug use, just you don't need to put anything there. So we're not going to make a person have a drug addiction issue. Okay. So pretty much, like, just say if I was doing an assessment, either if there was no substance abuse issues, I would just draw a line through this page, which that lets the person know that there were no issues, or just where it says substance abuse, just put NA beside that title, which means there are no substance abuse issues. Okay. Okay, so the next part, clients request goals and expectations, and then clinical summary. So in treatment, we like to ask the client, well, what do you expect? What are some of your goals, right? That you would like to have. So that's where that collaboration comes in. So anything that that client says, I really, really would like to do this, or here's my expectations in reference to receiving support. So whatever that looks like. So does that make sense? So any of their, it could be a request, it could be goals or expectations of treatment. Okay. And then clinical summary, you're going to pull this all together. So that's kind of everything. Um, and once again, there's not a lot of lines here, so you're just doing, once again, this is where it's a little, it can be a little hard to kind of summarize all of this information, but that's where the practice is. Now, in your textbook, and I want to say I don't have I have the textbook not in front of me. I want to say that the chapter that talks about the social history, there is a example social history in there. Okay, so look at that to see how they did each of these sections. Especially, like, I know for Professor Meister's, I'm not sure how far y'all go. Y'all don't go past the mental status exam, so y'all do the basic social history. So once again, in the textbook, you will see an example, and I'll put exactly on this PowerPoint, you'll see, go to this page, and that's the full example of the social history. And then you can kind of see, oh, this is what a clinical summary looks like. Okay. So impressions and recommendations, you're probably saying, what's that, right? Not what is that, but impressions sounds much like clinical summary, but it is not. It's kind of your impression of, the situation, and of course your recommendations. So I'm going to go to the next slide where I actually cut and paste the example from the textbook so that you can see an example of what that looks like. Okay, so this is the diagnostic impression. So you will need to diagnose this client. So do they have depression, anxiety? In situations where there have been life-altering challenges or life-altering changes, adjustment disorder, which falls under Axis One, is a diagnosis that is frequently used. So say sometimes we don't have clients that have major depression or anxiety issues or ADHD, like a client, for an example, that it's maybe they got divorced, so that might fall under major adjustment disorder, right? You're going to go ahead and diagnose that client on axis 1, 2, 3, 4, 5, and of course remember now this form that you're using, the reason why you still see the axis here is because this form is actually from an older edition of this book. Okay, so this form is a little old, but I still want you to have the robust experience of filling out forms for case management, psychosocial, and things like that. So that's why that's why I'm using this. Okay. With that being said, I know some of you may not actually have the DSM, but I will put a PowerPoint that gives you all the different axes with the different diagnoses. Not all of the different diagnoses, but some examples of the disorders that fall under the DSM. Okay? And if all else fails, the internet has everything. So if you did a Google search and said, give me the diagnosis under Axis for mental health for Axis 1, it's going to come up. Y'all know that. So, okay. So, yeah, I mean, I don't want you to get too stuck on this. Typically, most of your clients will have a diagnosis on Axis 1. Axis 2, remember, is your personality disorders. Some of them will not have that. Antisocial personality disorder, borderline personality disorder. So a lot of times you can just, if there is no axis, if there is no personality disorders, just put none. Remember, axis 3 is simply a medical condition. So like many of you said, your clients were dealing with issues like insomnia. That's a medical issue. Okay, axis 4 would be the issues, the environmental issues that cause the problem. Okay, and once again, I will have a PowerPoint that outlines these things, particularly for the DSM. And then axis 5 is that GAF score. Okay, and you can just put the range in which you think your client will fall. And I will also give you on the PowerPoint, I'll give you what those ranges are. And then you can just select, hey, you think that your client falls between the range of, let's say 91 and 81. Okay. So you would just go ahead and put that range. Okay. All right. Thank you. Okay, so here you're going to see an example, and this little circle is hiding one of the words. But basically, it says she's a 47-year-old married woman with one daughter away in college, is requesting help for depression. She states that she is almost 2 years starting with the death of her mother. She states her husband is insisting she go for help. So here's starting where you get into your impression. She is competent. But modest, person who is coherent and oriented times 3. Her experience was very neat. Her affect was flat, and she expressed concern that she gave accurate and useful information to the worker. She reports loss of interest in activities that formerly gave her pleasure. Impaired social functioning and hypersomnia have increased, difficulty causing her to seek help. Husband supports this. During the interview, client has difficulty discussing herself and her accomplishments. She tends to minimize her success and focus on things she could have done better. She's requested medication, and in discussion with CM agreed to with case manager. She's agreed to 3 sessions of counseling to address general feelings of depression and an appointment for a psychiatric evaluations, recommended medications and psychiatric evaluation with Dr. Kremlich, and 3 initial sessions with Bayview Counseling Services. Okay, so you see, so when you think about, as you see, it's the authors, it's kind of, you're highlighting some of the things that was said. So you're not trying to do a total summary. When you're talking about impressions and recommendations, the impression is, okay, where were those points in which she struggled or in which the client struggled? That's what you're kind of bringing out. And then recommendations, like we have a recommendation here for medication, psychiatric evaluation. Your recommendations could be, of course, clinical, therapy. It could be, going to the doctors and things, going to a medical practitioner for insomnia. All right. And also feel free to look at your ABC assessment, because remember you did a plan of coping. So some of those are recommendations as well, right? Now, don't get into too in the weeds. Don't be like, client is recommended to journal 3 times a week, right? We're talking about a broad overview of recommendations. So not the details, but like, client is recommended to go see a psychiatrist, a medical practitioner for insomnia. Client will be referred to, needs to do substance abuse treatment, inpatient, outpatient. So that's what you're kind of targeting there. Does that make sense? But you can refer it back to your plan of coping to take out some of that information. Okay, and I hope that makes sense. Okay, so here's the treatment plan. So basically, you're going to have the client's name, next of kin. Don't worry about that. And this is going to be the initial plan, so don't worry about updated plan. So the initial plan plus the date that you're doing it, which you can put the date that you're actually doing this. Developed with, that would be the client themselves. Okay, so developed with the client. Okay. Level of case management, that would be resource coordination. So remember in the previous slide, we talked about the different levels of case management. So this would be resource coordination, and you are the case manager, okay? And then once again, that provisional diagnosis. You're going to repeat that diagnosis there, okay? And you're probably like, some of these things are repetitive, but that's okay, because in a client's file, sometimes these things get separated, so it's never a bad idea to see information over and over and over again, okay? All right, and then you're going to look, so we've already talked about this. So these are the things in which you are helping the client with, or these are the things where they may already have strengths. We went over this in class, but just a brief review: income, financial situation, housing, vocational, which is job, educational, transportation, activities of daily living, that is, can the client, are they able to do their daily things that you're supposed to do, get up and get dressed, use the bathroom, clean the house, brush your teeth, take a shower, run errands. That's the activities of daily living. Okay, medical, are there any legal concerns? Recreation and leisure time. So remember, a lot of you talked about, even in your assessments, that because of what the client had went through, many of them were isolating themselves. So that would be an example of a need, because they're not actually doing those things they used to do. Mental health, substance abuse, family relationships, social supports, and then other would be something else. Anything else that the client may have mentioned, you can put there. Okay, so basically you're going to you're going to say whether it's a strength or a need. Now, you need to select at the minimum at least 4 things that the clients need. Okay, 4 to 5 needs, at the minimum 4. If it's more, that's fine. But I definitely want to see at least 4 things checked on here. And then at least 3 to 4 strengths. 3 at the minimum. Once again, some of these things won't be checked at all. Okay, medical may not be a strength or a need. Okay. And then when you're looking at, actually, I'm going to go to the next slide, which is going to show you how this looks filled out. Okay, ignore what I said on the last slide. I said I was going to go to the next slide. So remember, I already did a slide where it basically showed you what this form looks like filled out, the goal that you're going to have. Comment is like, for an example, if it's a strength, you can say how and why it's a strength. And referral would be where you're going to refer that person to, if need be, for additional help with that. Like, for an example, vocational, you might actually refer them to a job coach. Okay. So I'm sorry, I already explained that a while ago. Okay. All right, so we're going to move on to referral notification form. So a part of course, what we do is we have to refer clients, because we don't have agencies that are one-stop shop and safe. So we have to refer clients to multiple agencies. So just pick one agency or that you would want to refer them to. Once again, same information: client, address, phone number, things like that. Date of referral is when you're going to actually send it. Once again, you're going to put that diagnosis on there. Okay. And then the provider that you're sending it to. So just say if this is, give me, oh gosh, one of the addiction agencies, you would put the name of the agency, the type of service would be substance abuse, inpatient, outpatient, and for the purpose of. So then you would simply state you're referring the client there for the purpose of receiving inpatient addiction treatment. I'm trying to think about one of our agencies. It could be ADI that we have, Pathways, whatever the case may be, right? It doesn't have to be addiction, of course. So any agency, so just say even for an example, you want to refer that client to get a psychiatric evaluation. So then that would be the referral, or maybe for therapeutic services, medical, whatever the case may be. Just want you to fill that out, okay? Review date, target date, don't worry about that. Do not worry about, because once again, sometimes I know that these things ask a lot of questions. So don't worry about the review date. Don't worry about the target date. Okay. But referring case manager is yourself. Okay. And that review date and target date is probably like, okay, we're going to see, did this client get referred to the agency? How are things going, et cetera, et cetera. Okay. So don't worry about that for now. Okay. All right. So then the last one is the discharge summary. So just say we've worked with this client. This is months later. So I do want you to fill this out just to once again get into the habit of knowing how to actually fill out a discharge summary. Okay. Name, date of birth, date of admission, all right, and date of discharge. So that should be a few months away. That might be a year from now. Okay. If you're doing the plan today, then that date of discharge might be a year from now. Diagnosis of admission. So once again, you're going to put that diagnosis on there. Were there any medications? If not, don't worry about that. What is the reason for discharge? So just say if the reason for discharge is because the client has achieved all of their goals, just, you can basically say that, okay? Presenting problem. So once again, you're going to go back. The presenting problem, I believe, is on here. So you're just going to repeat the information. Yeah, so you're going to just copy the same thing that you have that you did for the social history, okay? And then some of the goals, right? So those goals, if you just want to provide a brief update on those goals, client was able to successfully complete inpatient treatment. Client was able to, whatever, did 6 months of therapy, whatever the case may be. So that part, we're going to pretend like the client did a good job, okay? And they were able to accomplish most of their goals. Now, you can be creative and say client was able to do these 3 things. They were able to be successful at completing outpatient treatment. They were successful at getting a new job. However, patient was not successful at this, right? So, because we do have to be real that sometimes our clients won't always be able to accomplish everything. Okay. Oh, I'm sorry. I went too far. So goals is the goals. So those are the goals that are on that plan. Okay. So those are the goals that are on the case management plan. I'm sorry, I went too far. Now talk about the progress of those goals. Okay, so on the next page is the progress. And then additional issues not addressed. So there anything that didn't get completed or needs to be further addressed, but needs to be addressed elsewhere, like client needs further this, right? You can put that there. And if not, you can put not applicable. And issues and impressions. It doesn't say that at all. Impressions and recommendations. So once again, what is your impression of this client? And do you have any further recommendations? So this is your final impression. Client did an excellent job. Client was very motivated. All goals were achieved. So this is your final impression and any recommendations. And if there are no recommendations, you can simply put no recommendations. And then of course you're going to sign. Okay. All right, so that's that. Let me know if you have any questions. I know this is a long video, so hopefully you could watch it in parts. But if you got this far, that means you have watched it towards the whole end. All right, thank you.